Let's start talking about the body's internal organs. One thing I have stressed and I want to continue to stress is drawing all these images yourself. There's going to be no better way to learn this material than drawing it yourself. You do not have to be a good artist. Just do it to the best of your ability, and that's going to be a huge adjunct to learning the material in addition to looking at images. So what we can see here from top to bottom, the esophagus, which is coming from the oral cavity into the stomach. From the stomach, we move into the intestine, specifically the small intestine, which we see here in green, blue, and red. There are 3 segments to the small intestine. The duodenum is the first region of the small intestine. The middle region is the jejunum, and the last region is the ileum. Duodenum, jejunum, and ileum. The ileum joins with the cecum, which is the beginning of the large intestine. As we can see coming off the cecum right here, we have the appendix, and then we proceed up the ascending colon, the transverse colon, and the descending colon. The descending colon gives rise to a region known as the sigmoid colon because of the S-shaped morphology of this region of the intestine. And from the sigmoid colon, we enter the rectum and finally the anus. As the ascending colon turns towards the left, and keep in mind, this is in standard anatomical position, so this direction is moving towards the left. Ascending colon onto the transverse colon, we have the right colic flexure right here. And then when the transverse colon starts descending, that turn right here is known as the left colic flexure. Right colic flexure, left colic flexure. Taking a look at this image right here, esophagus, stomach. This right here is the pancreas, which contributes digestive enzymes into the duodenum, into the small intestine. We can see the liver right here, the gallbladder. This right here is the transverse colon, ascending colon, cecum, appendix. All of this is small intestine. If we go back to this slide right here, the segmentation in the large intestines that we see right here are known as haustra. And this right here is a ribbon of smooth muscle that runs along the large intestine known as the tinea coli. Above the diaphragm, so everything we're looking at here is below the diaphragm. Both of these pictures are below the diaphragm with the exception of the esophagus right here. Above the diaphragm, we cannot forget the lungs, the right and left lung. The right lung has 3 lobes, superior, middle, and inferior, whereas the left lung only has 2 lobes, superior and inferior. This notch right here in the left lobe is known as the cardiac impression that gives room for the heart right here. And once again, this is the diaphragm.